Thank you so much for being here and listening to me. I really like to do this kind of volunteer teams because honestly, I have been always doing volunteer since a young age. Today I'm going to tell a little about my story, about my professional story, but also it doesn't matter, I think, which profession we have. Our personal story always impact in our professional pathway, right? So I will start. I'm from Costa Rica. I have always been living here. I have always studied here. You know, when I am in this kind of things that are international, many people sometimes want to travel and study abroad. And I think it's a good opportunity, but also when you study in your own country and when we are talking about health, I think it's very important to know about our context. You know, when you learn in other places, sometimes you learn about things in other races, like if you study in Europe or United States, is different if you have some problems, for example, in our context, which is Latin American. So I have been always study here, and I take trainings and seminars from other countries, but all the time I have been working here and studying here in Costa Rica. I graduated from university when I was 21 years old. That I think that for some people is a young age when you started so young. Sometimes people say that you can work in this, that this is a hard profession, that you can understand that problems that adults have, you know, and they said that maybe you have to do other things before start working. But at least here in Latin America, when you finish university, you need to start working as soon as possible, because usually we study with money that the bank give us, or maybe our parents finance our studies, but they want that we need to start working as soon as possible. In my case, I received a scholarship, which was a good thing, but not all my friends has this opportunity. So, and also in Latin America, usually the unemployment rate in young people is very high, so it's complicated. And I will tell a little bit about that hard part of the pathway. And when I think about that, I feel sad, but then I remember that that was just a part of my story, not the whole story. And an older sister, and I think that's important because, like I said, what we are in path in our professional pathway. And it's funny because people believe that I am not an older sister, but I am, and I have these responsibilities that usually we have, you know, to be the role model and to uh, to design the path for your younger brothers and sisters. So I think it's another thing to take in account. I had been volunteering since I was 12 years old. I started as a young age as I was like, when I was in high school, I teach music to, when I was in high school, I teach music to children in my school. And then when I was at university, I taught music to people from high school. You know, I do that when I was studying also. And I think that's also important. When we are studying, when we are working, especially in health area, which is very hard, very demanding, and a very complicated area to work, we need to do something else. I mean, I love my profession, but also we need to be something else, not just a psychologist, not just a dentist, not just a doctor, you know. For example, my sister is a doctor, so I understand what it's about to work and live in a family when we are health professionals. I love reading and watch movies, which is, I think, is very common in psychologists. We love read a lot, and we have to read a lot. So I think it's important. And when I was choosing my career, I was thinking literature because I love books. But at the end, I don't do it because honestly, I think you can live, you know, with the salary of someone that has this profession, at least here in Costa Rica. So that was the reason I choose psychology. But I mean, I love both things, you know, I can do that things. How a child, I just want to be a child. And then when I was in high school in my last year, you could hear me because the internet said this unstable. It's working. About how I choose my career. When I listened some people that said when I was a child, I want to be like that, blah, blah. When I was a child, I just want to be a child. And when I was in my last year in high school, I have to choose like all the people I think about the career. I was 16 and I love books, so I would like to study literature. And then I remember a story about my mom, and that's the reason I said my mom in my story. My mom was a teacher from a school, and we live in a vulnerable place here in Costa Rica, which is called, the name is Desamparados, which in English means something like the abandoned people, something like that. It's a really weird name for a city, but you know, and this is a place when we have a lot of violence and risk vulnerable situations. And my mom worked in this school. I went to this school, and I remember that when my mom was checking homeworks for of their student, right? She always said, this student is very brilliant and smart. And when I read the file of the story of this kid and his family, because I don't know why I like to read that when I was 12 years old, but well, I read that maybe this kid became have a family that have a dad and a mom, and they live in a good family, you know. And when I read the story about the kid that has low grades, and maybe he has some learning issues to study, this kid come from a family that maybe his dad was in the jail, and maybe his mom was with some social situations. They don't have food to eat, and they have a very vulnerable situation. So at the beginning, I choose study psychology because I want to be a educational psychologist. You know, I want to study and become a psychologist in high school. At the end, that wasn't my path because I don't like that, but that was the reason I studied that. And in 2007, in 2006, I went with my dad to different universities, and I go to different places, and and I go to the places, talk to people with the professors, look at the labs, and I choose the place where I feel like at home. I'm a very intuitive person. Maybe it's not a very scientific method to choose a university, but I choose the university in the place where I feel like I was at home. And I think when we study psychology, it's important because we work with people, and we have to trust in our sense and also in what people. I think we have a different to read feelings of the people. Maybe it's different from other health careers. So I choose this university that was the Latin University here in Costa Rica. I like I said, I obtained a scholarship because it's a private university and you have to pay for your education. So I was 3 years there studying the bachelor's degree, because here in Latin America we have the bachelor and then something called licentiate. It's not like in Europe that you study a master, for example. And then when I finished my career in 2010, I was 21 years old, and then I had to look for a job. And to me, that was one of my worst years of my life because I was an employee. I go to like, I don't know, 30 interviews maybe, and people said, no, you have a good resume, but you are so young, you can work in this. Clinical psychology is very hard. You can understand the problems of people. People come to psychology to talk about divorce, to talk about their children, to talk about, I don't know, and you are very young, you don't have lived enough to understand people, but always listen to us. I applied for a job in a place called Red Cross. I don't know in your countries, but here in Costa Rica, Red Cross is known for the ambulance service, you know, people that attend patients with injuries. But obviously that wasn't my area of work. I didn't work with that, but also Red Cross has a program called Youth Red Cross, and they work in programs to prevent violence. So I applied for this job. It was a 3-month project job, a short job, but I fell in love with Red Cross, and it was my first job. They gave me opportunity, and they hired me for 3 reasons: because I was young, because I was a volunteer before, and because I live in a place which is a vulnerable place. And this project was to work in that community. I mean, in my community. And I don't have any fear to be in my community because I live here. So they hired me. I worked there. Then I finished my project. And since then, I am a volunteer in Red Cross. Then I have to apply and look for another job. It was a job in a company. I didn't like it a lot. And then I applied for working in SOS Children Villages, which is an NGO that work with children and families that are separate due violent situations. And I worked there for 4 years. And then I transferred to my current job at government. I work in social services. And when I started to work at government, I also come back to the university and study my master's degree, because obviously, at least here in Costa Rica, you have to take your master when you have experience. If you don't have experience, professional experience on the field, you can take a master, because usually the masters are for people that are already working on the field, right? It's a little different to other places. And that was my journey in a very summarized way. What how what has been the hardest part? I think that 2 parts. My unemployed year, like I said, I was depressed, I think, honestly. I just looked TV and, do volunteers, and I was very, very frustrated. And the other thing has been 2020. To me, be a professional in a pandemic, I think it's something that no one prepared me for that. I mean, I have never been they never taught me in university that when you have to work in a pandemic, you have to do that. No one explained you that. And it was very hard because the health professionals, we were essential professionals. So I think in all the world, we continue working. We never stopped working, and we continue working on the field. We have to use our equipment and everything, but we feel a lot of fear and a lot of frustration. Honestly, I think I was depressed too at that point in my life, because I was like very frustrated and with a lot of fear, but I have to support my patients and also my colleagues, because usually when a crisis hit us in the places, people looked at psychologists, right? So I have to take care for my colleagues, the social workers, the medics, the doctors, the nurses, and everyone. But the question is, who cares? Who cares us? Who cares the one that cares the other one? So that was something that I learned too, and that was the reason I became an activist of the self-care, because I think that before pandemic, we didn't understand honestly the importance of that. Um, about the child protection system, which is the place I work. When you are a psychologist, you can work in hospitals, you can work in schools, you can work in organizations, you can work in different places. But in my case, I work in the child protection system, right? Um, it's different in each country, but I think it's important to know that, for example, in the case of the Americas, we have to remember that we are one of the most violent regions. Maybe we don't have a civil war, but we have problems with guns, with drugs, with these kind of situations, and the migration also is doing a lot of complicated things here. When you visit Americas, I think every one of us had a story about someone that stole your wallet or something. It's part of our lives, sadly. In the case of Costa Rica, we are a country with a good health system and with a good education system, but we are one of the countries with that highest rate of inequalities, right? We had people with a lot of money, and next to them live people that they don't have nothing to eat, and it's very complicated. So we work with these families. in the child protection system, we take care of the families affected by violence, by poverty, and the different violent situations, like sexual abuse, physical abuse, um, human trafficking, exploitation, um, and all this kind of gender-based violence, right? And so that's the kind of families and patients that I take care every day. And sometimes when the risk is very high, we have to separate children and teenagers from their houses. So they live in different places, the foster care of the kinship care system. So my patients came from families that are in violent situation, but also children that live in the foster care system, for example. So it's two different kind of families. If you don't know anything about the social protection system, I think there are two movies that I like to always explain, that I think when I saw these movies, I feel reflected in these movies. When you saw the professionals, I feel like them. So I think they are very good movies about social system protection, which are Instant Family, which is a family about the United States social system, but it's similar to other places. And Lion, which is a story about a person from India, I think, that migrate and they get adoption. So the situations and the trauma that they live is what I work, with complex trauma. So I think you can watch these movies to understand more about the protection system. About my current work, I think what I like most about my work is that I do different things every single day. Every single day is different. Every single day it's a new adventure, and I like it because I hate to be at the office all days. I can do that. So Mondays I have to be in the office, and I do in presence and fun orientation. I think in pandemic became more popular, but we give crisis intervention by phone and also in presence and guidance. Sometimes people just need counseling, for example, to know what to do about something. My kid is struggling with something, what I can do, or I have a problem with my ex-wife, what I can do. Tuesday, I have to write reports because we work with the court, the family court, that usually decide about the situation of the children. So I have to write a lot of reports. In the middle of the week, I do sessions with the families, but I do home visits. I go to the communities, which I love. I go to the communities and sit in the living room of the house of the people, and there we do everything. I think it's a social way to do our professional. That it's a way to people receive good health services in their houses, because sometimes people can travel, they don't have the money, or they live in places very far away. I work in rural areas here in Costa Rica. We have to go to the mountain. We work with indigenous people. I work with people that they don't know how to write or read. So they can just go and ask an appointment. It's very hard for them. So we go and give the service in the community. On Thursday, I visit the foster care houses and the alternative care. I also do professional case meetings and sessions with the children, talking about their situation, their families, and their fears, dreams, and hopes. And Fridays, I do what usually people think we do, that psychologists do. In my office, I visit the patients and I give the attention. As you know, as you can see, all days are different. In this common view about what a psychologist do, I do it, but just on Fridays. The other days, I do different things. And on Saturdays, like today, I am a professor at university, so I give my classes at Saturdays. I work 6 days a week because also here in Costa Rica, at least, it's kind of hard to have just one job. And well, I like it. But also, like I said, if you like, at least here in Costa Rica, the social area and the community feel, we have a lot of opportunities to work because we have a lot of programs and NGOs that have positions for psychologists that like this kind of things. Maybe if we just like the clinical area could be a little more difficult, because here at least the health needs to be also social, right? Depends on the context, I think. I think that the most important and what could be a good reason for someone to choose this career is that if we like to help people, if we like to protect the most vulnerable, you could be a psychologist in the child protection system, a trauma psychologist, because they need us a lot. There are NGOs that finance our positions, so there we always gonna have jobs. And it's hard, but at the same time, give us a lot of the opportunities to change the lives of people. When you help a child or a teenager to overrate their trauma, right? You are helping someone that when became an adult, gonna be thankful for your job. And I think that to me, that's the most important. I mean, you don't have to choose this job if you don't like to feel frustrated. Could be a little complicated because sometimes things doesn't work like you want it to work. And if you are over empathetic, maybe it could be a problem, because if you don't know how to turn off your brain, you can be thinking about your patients all day, right? And I think that's happened us in COVID pandemic. A lot of professionals, health professionals, we had problems with that, to turn off on COVID, because we have been receiving information all day. And that's something we have to learn outside the university, because usually universities doesn't train students and these kind of things about mindfulness, self-care, and these kind of things. Usually they train us about how to give the best service for our patients, but they forgot how to teach us to give the best service or also for us. And if we want to work in these teams for 30 years, 40 years, we have to take care of us. What motivates me in crisis? Definitely in my case is volunteering. And maybe it could be sound weird, because I know when people think about Red Cross, obviously it's about also suffering and helping people in disasters. But to me, it's different. What I do in Red Cross is different for what I do in my normal job, because in Red Cross, I work more in the community and I work more in prevention, health prevention, promotion of mental health, campaigns. It's different, because I think that I can help to prevent people do, for example, a suicide, or for example, I can help people to avoid live a trauma, or at least obtain skills and tools to face that trauma. It's different when you are just attending people that are suffering. At least in Red Cross, you can help people that are not in suffering. We talk about the peace environment, and we work in peace too, so not just working the conflict. So to me, when we are volunteers, we are helping a lot. And also I always think that when we became professionals, sometimes we forget to do that the part of serve the other ones, to serving people and also doing volunteer. If you are a professional that has 10 years of experience, 20 years, when you are doing volunteer, you are helping other ones. For example, like in this program, you help students with professionals to look their career, to know more about the profession and everything. When I was in high school, no one teach me about nothing. I just choose psychologist because I think that maybe can be something that I would like, but maybe I could be wrong, and at the end I have to choose to change my career. At least when we are doing volunteer, we help people in a different ways, and I think at the end the life give us back. When we give, the life also return back something for us. I believe in that. So also I always promote to do volunteer in any place. It doesn't matter the place. What I love, what I do, like I said, it's never the same. It's always different. It doesn't matter how much you study of anything. When I start studying 10 years ago, for example, just to give an example, um, like five, no, when I was, okay, in 80s, for example, being gay was a disease, a mental disease, you know? And right now, you know that that's not a disease. So if you don't study, you are not going to be updated about what happened with people, and that's very important. Or for example, when I study, I remember people talk about multiple personality disorder, and that doesn't exist anymore. We know right now that we are talking about dissociation, and it's related to trauma. So we always have to be learning and studying and doing new things, because humans are very complex and situations are very complex. And with pandemic, I think we are gonna discover new things about our mental health. So that's what I like about my job. Also, I liked that currently, thanks to pandemic, I think people understand that mental health is a priority. So if someone wants to choose this career, I think this person gonna have more opportunities to get a job than in my case, for example. Because when I study, people was like, I don't know what is that. I don't know. Psychologist is just for people that are crazy. I'm not crazy, you know. And now people understand that psychologists can help people in different ways, not just someone with a disease. You can help in communities, in life skills, in the life project or someone. You can also help in communities, families, high schools. So I think that could be something good. Other thing that it's important to remark is that we can work with other people. I work every day with social workers, lawyers, other professionals, nurses, teachers, and I like that. You know, I can learn a lot about the other ones. Um, Even if you work in neuropsychology, which right now is something very, very important, you can go to surgery rooms and watch surgeries and everything. And I think it's very interesting. We can work in different places, hospitals, high school, depends what you like. Like I said, in my case, I don't like work in an office, so I like my work, but I have friends that are very good in what they do, and they work in an office, you know, and they do it really good. So I think psychology offer a lot of areas to work. And like I said, you can change life. We support in the hardest part of the life of people, but also we can be the witnesses of the progress of this baby steps progress. When people start to feel good, start to feel happy, when someone was depressed and then start to feel okay, that's very, very rewarded. You know, you feel like you are doing a good job. Just one thing, if you want to choose this career, I think psychologists, we are not used to be on the spot, you know, because usually when you are working with patients, we don't take pictures, obviously, we don't record the videos, we don't do that, you know. You can, but when you think about other health professionals, they are always on the spot, you know, on the cover, because when a nurse is the first place and they give a vaccine, or maybe a doctor, they take pictures and everything. In the case of psychologists, we don't do that. So usually we like to be more on the shadow, maybe, but doing a very good job. So if someone is a little shy, maybe, or maybe a little introvert, and feel worry about the study this profession, I think could be okay, because at the end we work on the shadow. We don't work on the spotlight, you know. uh, the hard part, I think, definitely the suicide crisis, when you have patients that are in this situation, and maybe they can suicide. That's hard, you know. And maybe a doctor, when they are doing a surgery, a patient could die. But in the case of psychologists, we have that risk too, in a different way. It's a different risk, but we have it, and it's sad. And when that happens, you have to go to therapy too, to work about that, because at the end we care about people. And if your patient die, obviously you will be sad. The mental health diseases, they are very weird and not studied diseases, the personality disorders. And at least in Latin America, we don't have a lot of research. And I think that's hard because we receive the information from Europe and United States, but it's not the same. When you look at disorder in a Latin American person, it's different. The manifestations are different, and maybe we have to do more research. I think it's important that. Also, in my case, for example, I listen every single day about sexual abuse, physical abuse, gender-based abuse, exploitation, and you need to learn how to turn off. Honestly, sounds weird, but you need to learn turn off. If you can do that, you will be in burnout in months. But we can do it. We can learn that. We can do it. Um, but if you think that you can do it, maybe we can work in other area of psychology, maybe not with trauma survivals. Also, something that I learned in my pathway was that when I was in university, I always said, I will never attend someone that is an aggressor, someone that hits his wife, or I would never attend someone that touch a children, I said that. But something that I have learned in life is that these people also need someone that help them. And in my case, I help them too. It's weird, but I help people that kids, wife, and touch children, and someone have to do it, because sometimes these people maybe can have this last opportunity to change. And if you don't do it, at the end, no one will help them, right? Because usually people don't want to work with this population. And that's the final advice about how balance between compassion and boundaries. I think psychologists, we are very compassionate people, but we have to put boundaries and limits and turn off our brains to know how, when we are psychologists and when we are not working, we are just humans. We're normal feelings or normal behaviors and normal situation, and we can be in a party just laughing and living our lives and not analyzing people. Usually people say that when you said I am psychologist, people say don't analyze me, you are analyze me, and I always say no, uh, be quiet. I'm not analyzing you. I mean, I'm just having fun. I'm not working. Relax. But sometimes people believe that we are always doing the same, and that's my biggest learning from pandemic. We have to take care of us. No one is going to take care of us, just us. So I understand through the hard part that we had to take care in pandemic. I start to get sick a lot about different things. I start to feel dermatitis, and then I feel headaches, and then I feel, mm, different things. I don't sleep well, and I go to different doctors, and all they told me the same thing. They said me that they have been receiving a lot of professionals from the health area with different situations, because we were working under so much stress that the only way that we understand that we were bad was with our body. Our body start to say, hey, you have to stop, you have to take care, you have to do something. But in pandemic, no one took vacations. Who will take vacations? I mean, to which place? You can do anything. So we were like 1 year and a half with no free days, and I start get sick. Not, it wasn't, thank God, nothing any complicated, but I start with different things, and I have never had any disease. So I was really worried. So I come back to therapy. I was already once in therapy, but I come back to therapy. Before that, I have already meditate and do yoga, but with pandemic, I do it more, like 2 times a day or something like that. And I start to do different things, something completely different. And I start to do ballet. I have never been dance. I have never been in ballet before, and I am an adult, and I enrolled to a ballet adult class to start to do something completely different. You know, when I go to ballet, people talk about a lot of things, but no one talk about mental health, no one talk about patients, no one talk about hospitals, no one talk about violence. And to me, that's very important to have a place in which people talk about something completely different from what I have been hearing all day, you know? And that's the reason I said that movement and the art are therapy too. Sometimes I have patients that they said me I'm depressed. And when I ask them why they believe they are depressed on what they do in in his daily life, they explain me they work all day, they study all day, then they watch Netflix and they scroll, you know, in TikTok and Instagram, but they never go out. They never receive the sun. We live in a tropical country, you know. In Costa Rica, we have a lot of nature. We have sun. We have a very good summer. We have mountains and we have beaches. And people believe that here in Costa Rica we are very relaxed, but no, people live very stressful. So I always say we have a lot of nature. We have to use it. We have people travel from around the world to come here. We have these animals around us, so you have to start to receiving some, you have to start to walk out, and you will see that maybe your brain doesn't need therapy or doesn't need medications, just need to go out and live the life, you know. Sometimes, yes, sometimes people require obviously the medication and the therapy, but sometimes it's just as we are forgetting to live, and we are just focused on working and studying, and that's it, you know. And that's the reason I am an advocate about self-care. I do it in Red Cross also, and I do it in my life. And every time I can with my students, I always try to 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 leave them these messages for their future, you know, because at the end maybe when we are young we have some resistance, but when we have 20 years doing the same, I don't know if we can do that. And maybe we have also other dreams, you know, have a family, married, travel, learn something new, study a second career, and the idea is to live a good life, not just survive, you know. And well, that's it. I don't know if I was too fast or what. I hope you can understand me. And I don't know if you have any questions or something. Okay. Well, in fact, I am a professor, you know, so I receive this question all the time from my students. And I always said, first of all, your planner or your agenda is your best friend. It doesn't matter if it's a physical, you know, a paper agenda or a cell phone or whatever, but we have to use that. Definitely. I mean, if I don't write what all I have to do, I will forget it. Trust me. I have sticky notes in my computer and everything, you know, to remember these kind of things. But this is the difference maybe from other advice you have listened. When I talk about an agenda, I included also my free time. Sounds stupid, I know, but if you don't include it, you won't have it, because we live in a very stressful world, honestly. So I write my free time. I mean, I put a meeting called free time. It doesn't matter. The importance is that it's in our calendar, will be in our agenda. So we are going to remember that's important. For example, if I have a lunch with my mom, I write that lunch with my mom, because the lunch with my mom is so important as my patient, you know. And if you don't do that, for example, in my case, I will forget and I will book a meeting or something, a patient session on the lunch, because we forget that. Because obviously, if someone calls you crying and telling, hey, I'm in crisis, I need a session, please, you can help me. If you don't do that, obviously, your compassion will win you, and you will give the space for your patient, which is good, but you will forget your mother, for example, and that's not good. So my advice is use a calendar, agenda, or something, but also book all the normal stuff. Don't do nothing. Just watch the sun. Go to the grocery. I have a friend that he never write that, and he never had time to go to the grocery store. And I told him, write him, because you have to do it. Take in account obviously the cars and everything, the time you use to travel and come back. And he do it. And when he start to do that, he never forgot again buy his food, and it's important. So that's my advice. Or in Latin America, I think at least here in the Americas, we have like three, three, yeah, three countries that are like the grandfathers of the psychologists here in the Americas: Argentina, Chile, and Mexico, which are the big ones. Usually, we study with professors that study with these original teachers. And also, we receive a lot of migrants here in Costa Rica. We have a lot of migration. We are a coast country, so we receive a lot of professors from Argentina, Chile. So part of my education become from professors from these countries. So I think in Latin America, we have evolved with some discrimination in some places, and we have some problems, inequality. So we can never forget the political side, but in some countries, not all the countries, but in some countries, we have evolved more to do research. And like I said, Argentina, Mexico, and Chile are the countries with the most research universities and labs and everything. If I will have the opportunity to study in other country, I would choose, for example, Chile or Argentina. The problem was that honestly, I don't have the money and I have to work, so that was the reason I do my master here. But if someone can travel, I think could be good because it's similar. The situation is similar, but they are more advanced. Um, maybe we need to learn about um, maybe we need to learn about other countries that we are more connected to health area, because at least here usually people believe that we are more social, not health professionals. So they believe that we are more like sociologists or anthropologists, social workers, and sometimes they get confused. So maybe we have to do that. Being participating in seminars in Congress from people that work in United States, and obviously, for example, they receive a lot of Latin American patients, right? I think that when we are work with Latin American patients, we have to work three things: violence, our violence history. We have all of us have a violence history. All the inequality. We came from countries that we have a lot on inequality. I mean, when I travel to Europe, for example, I always shock in a good way about the situation that, for example, I can walk at night and no one will do me something. I'm a woman. I can do that here in Americas. I can do that. If I go out at night, I just thinking bad things. So these things are very from us, from our culture. And when we travel to other places, sometimes people forget that, or they don't even know we feel that. So when we do migration process can be a problem. And also, I think maybe that for us, the family is very important. We are a family culture. Um, so I don't know this movie that Disney launched, Encanto, right? This movie from the Colombian family that flew away from the conflict. To me, that's a very good example of a family in Latin America. And in other places, maybe when we go to other health professionals, they want to treat us like we were just individual people, and they forgot our family. And for us, that is very important. Our family, and also the spiritual area. Latin America, we have a lot of, when someone dies, for example, for us it's very important the spiritual way. And if you are just very cold and said that no, that doesn't exist, we are scientific, we don't talk about heaven, I don't know, it feels like you are not empathized with me. That's a problem for a Latin American person, you know. You have to watch this movie. Like I said, Instant Family, it's an amazing movie, but they do it very well, very, 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 a very good acting and everything. But I think how can I say that, when we are working with trauma children, right, with we need to be patient, very patient. And for example, that's a problem with the system. you know, that I don't talk about a lot about the system, but the system demands you numbers, and you know, you have to therapy sessions and that's it, and no. Or for example, when people is paying an insurance, the insurance is just for some sessions, and we are talking about trauma. The trauma, I do yoga and I meditate. I think it's good. Other people do mindfulness and things like that. And also, I think we something that the children are very good to read people. So when they notice that when say bad news. Just an example. Last week I went to a foster care and I had to tell a children that he can combat with his mother still in alcohol problems. Obviously, he cries, you know, obviously, it's his mother. I mean, but I explained him that he has the possibility to live with another relative, that maybe his grandmother could take care of him. But we have to do a visit to his grandmother that took a month, and then we are gonna do some video calls, and then maybe he can go out with his mother. And he was happy. I mean, he was crying and then was happy, because that's normal when you don't know how to that through. Even it's a sad truth, because at the end I have to explain this kid that we have to do a bureaucracy progress, a bureaucracy steps. No, first visit, then video calls, and then it's not that he just go out with his grandmother from one day to another one. If you can handle that, it could be a problem, because sometimes people lie to children because they don't want to be in suffering, but they are very resilient, and when you treat them with respect and with truth, they notice that in you, and they start open their trauma to you because they respect you. So I think that could be the best way to do it. Religion. Definitely, people believe in people believe in spells, people believe in saints, people believe in, and it doesn't matter the place, it doesn't matter, it could be the city, it doesn't matter. People prefer go to the priest before go to psychology. People prefer go to a witch before a psychology. I mean, that happened, and you have to learn that you don't have to fight against them. You have to work together with them. For example, with indigenous people, we do that. We work together with their shaman. I don't know that name in that word in English. With their spiritual leaders, we work together, because at the end, the idea is that the person is okay, it doesn't matter how. And the religion is the first theme. And the second one is the gender roles, For example, it's more common that women go to therapy than men. For a man go to therapy is like, oh, I mean, they don't do that. They don't go to therapy. They go just because they are forced to go for someone, an institution maybe. But with men, we have a lot of work to do too, and it's because to the gender role based on, yeah. Favorite part is that I learn every single day from people, you know. When you read, for example, in a book, a depression is blah, blah, depression is 1, 2, 3 symptoms, But when you saw a depression, it's completely different. The first time, for example, I saw a someone with a delirious, I mean, no book will describe that. No book will describe that, the magic of the mind, for example. So I think that what I like more is that I learn every single day for every person that I have the opportunity to know, to support, and to help. It doesn't matter if it's just 20 minutes or maybe a process from 1 year. Every single person helped me a lot, learn me, teach me a lot. If I work in a profession where everything was done, I get bored. I will quiet time, long time ago. So what I like is that we always have challenges and we always learn from people, and people teach us more than the books, definitely.